dear students, myself Bhavani Pentela, working as Assistant Professor in Noida Institute of Engineering and Technology, Greater Noida. Today I am here to cover anti-asthmatic drugs. So, let us go ready into it. So, what is a bronchial asthma? Bronchial asthma is characterized by hyper-responsiveness of a muscle. Hyper-responsive of a muscle. Which muscle? It is a smooth muscle, bronchial smooth muscle. Bronchial asthma is characterized by the hyper-responsiveness of a bronchial smooth muscle, which result in narrowing of an air tube, and finally it leads to the bronchial constriction and it causes the asthma. So, what is the main factors involved here? So, asthma is an inflammatory condition where you can see the edema. It is such a condition where you can cause the inflammation as well. So, what are the main symptoms involved in this asthma? Dyspnea, wheezing, cough, these are all the symptoms which you can see in the bronchial asthma. So, next we will move to the mediators. So, what are the mediators involved in the asthmatic problem? So, here there are some mediators like histamine, heparin, leukotrienes, prostaglandin, TNF alpha, interleukins. So, these are all the mediators which are responsible for the bronchial constriction and finally it will leads to the bronchial asthma. So, we will talk one by one. Heparin and histamine. So, these are the mediators which are released from the granules, and the next one is leukotrienes and prostaglandins. These are the mediators which are released from the membrane lipids, and finally TNF alpha. What the TNF stands? TNF stands tumor necrosis factor, and interleukins. These are all the mediators which are responsible for the inflammation or which are responsible for the bronchial asthma. So, we will study one by one here. Studying about the histamine. Histamine is a mediator which is released from the mast cell. When it releases from the mast cell, it will causes the bronchial constriction and which will leads to the asthma. Heparin is also a mediator which is released from the granules and which will causes the bronchial constriction. And next one, leukotrienes. So, what is in a leukotrienes? Leukotrienes is synthesized from the LOX pathway. So, what is the full name of LOX? Lipooxygenase pathway. And what about the prostaglandin? Prostaglandin is synthesized from COX pathway. So, what is the full name of COX? Cyclooxygenase pathway. So, if I am talking about the arachidonic acid will be liberated from the phospholipids with the help of phospholipase A2. So, arachidonic acid liberated from the phospholipids with the help of phospholipase A2 to generate, or with the presence of this arachidonic acid will rapidly oxidized by COX enzyme and LOX enzyme to produce leukotrienes. By COX pathway it will produce prostaglandin. So, if you see here, prostaglandin and leukotrienes both are the mediators not only responsible for the inflammation, it also causes the bronchial constriction and finally it will lead to the bronchial asthma. So, these are the two mediators which are involved to produce the bronchial asthma. So, which from where it has been derived? It will be liberated. The arachidonic acid is liberated from the phospholipase with the help of phospholipids. The arachidonic acid is liberated from the phospholipids with the help of phospholipase A2 and it is rapidly oxidized. Okay, this arachidonic acid rapidly oxidized by COX pathway and LOX pathway. So, cyclooxygenase pathway and lipooxygenase pathway to produce prostaglandin and leukotrienes respectively. So, these are the mediators which are responsible for the inflammation. And next we will talk with the TNF alpha and interleukins. So, what are the TNF alpha and interleukins? TNF alpha and interleukins are the mediators which are the cytokinins. Which type of cytokinins these are? These are the inflammatory cytokinins which are responsible for the bronchial constriction. And what is the pathogenesis involved here? So, the pathogenesis is an important role by which you can understand the disease in very much better way. So, asthma is now recognized as a primary inflammatory condition. So, just I had discussed now the asthma is an inflammatory condition from where you can see the constriction of a bronchial muscle. So, allergic reaction will also demonstrate in many adults and higher pediatric patients. So, there are a lot of other factors that also triggers the asthmatic condition worse when you expose it to the cold air or any pollutants, exercise, irritants, infection, all these are the factors that will trigger the asthmatic problem. And next one, by this picture you can see this is a normal airway. This is a normal way where the air can enters into the muzzle, and this is an asthmatic airway. This is an asthmatic airway where you can see the normal airway is it like this, the asthmatic airway. This is an asthmatic airway, and here the wall will get thickened. Here if you see these two conditions, here the wall will get thickened, and this is the asthmatic airway during attack. When the particular asthmatic patient having the asthmatic attack, in such a condition the airway will get how narrow. If you see here, if you see this figure here, you can understand that the air here the smooth muscle had get tightened, here the smooth muscle had get shrink. So, because of this smooth muscle shrink, there is no air passed into the tube. So, finally, the particular person will causes the bronchial constriction and which will leads to the asthma. So, by this figure you can understand in a better way. And next we will move to the types of asthma. So, how many types of asthma are there? Basically, asthma has been categorized into two types. One is extrinsic asthma and second one is intrinsic asthma. So, there are the major difference between extrinsic asthma and intrinsic asthma. If I am talking about extrinsic asthma, usually it is begin in childhood. So, this asthma usually it will begin in the childhood or early adulthood. So, which type of asthma will begin at childhood or early adulthood? The extrinsic asthma will begin in childhood or early adulthood. So, here hypersensitivity is due to allergens. In extrinsic asthma, the allergens due to the hypersensitivity to the allergens, the extrinsic asthma you will see. And if you see in the immunoglobulin antibodies, if you see IgE levels will be increased in the serum. And when you move to the intrinsic asthma, it will be little bit different to that of an extrinsic asthma. In intrinsic asthma, it develops later in childhood. In extrinsic asthma, it begins in the childhood. Please note this point. In extrinsic asthma, it begins in childhood. In intrinsic asthma, it develops later in childhood. After the childhood, it will develop the intrinsic asthma, and there will be no recognized allergens you will see in here. Normal IgE levels in the serum, and if you compare with extrinsic asthma, here IgE levels are increased, but in intrinsic asthma, the normal IgE levels in the serum. So, our difference between the intrinsic and extrinsic asthma, which of the one is the most common asthma? You will see here the intrinsic asthma is the most common asthma compared to that of extrinsic asthma. Extrinsic asthma will be caused according to the episodic. And next we will move to the classification. So, by the classification you can understand what are the drugs that you can treat the particular disorder. So, which disorder we are talking here? Anti-asthmatic drugs. So, this is the classification by which you can learn all the drugs in a same category to treat the asthmatic patients. So, here you will use the bronchial dilators. So, bronchial dilators are the drugs which will dilate the smooth muscle, which will relax the smooth muscle. In bronchial dilators, you will see the three types: B2 sympathomimetic drugs, methylxanthines and anticholinergic drugs. So, these are the three categories comes under bronchial dilators. Okay. So, first one is beta-2 sympathomimetics, second one is methylxanthines and third one is anticholinergics. Okay. So, first we will discuss about beta-2 sympathomimetics. So, what are the drugs comes under beta-2 sympathomimetics? Salbutamol, tibutaline. Okay, there is a lot of drugs which falls under beta-2 sympathomimetics, methylxanthines, theophylline, caffeine, okay, doxyphylline, aminophylline. So, these are all the drugs which falls under methylxanthines. And last one is anticholinergic drugs, which are the bronchodilators. Here, what are the anticholinergic drugs you are using here? Ipratropium bromide and tiotropium bromide. So, these are all the bronchodilators which are used to treat the bronchial asthma. This is the first category, bronchial dilator. Second one is leukotriene antagonists. Third one is mast cell stabilizers, fourth one is corticosteroids and fifth one is anti-IgE antibodies. So, these are the 5 types of drugs you can see in the asthmatic patients. So, these are the 5 types of asthmatic drugs you can given in the asthmatic conditions. First one is bronchodilators, second one is leukotriene antagonists, third one is mast cell stabilizers, fourth one is corticosteroids and fifth one is anti-IgE antibodies. Okay. So, these are all the drugs you can advise in the asthmatic patients. So, if you are talking about leukotriene antagonists, the montelukast, gefarulacast, these are the drugs which you can use as an leukotriene antagonist. It will bind to the leukotriene receptor and it will antagonize the action of leukotrienes. Mast cell stabilizers, these are the drugs which will stabilize the mast cell. And corticosteroids, here the corticosteroids you can give both systemic and inhalation corticosteroids to treat the asthmatic condition. And last one is anti-IgE antibodies. So, these are all the drugs which comes under asthma condition. And we will see mode of action one by one. So, mode of action is also called as mechanism of action, by which you can see or by which you can learn how the drug is showing action exactly into the body. So, by this way you can understand the drug action in a better way. So, first category beta 2 sympathomimetic. Which drug it is? Beta 2 sympathomimetic, it is a bronchodilator. So, what the drug does here, it is a protein bronchodilator and it will release the bronchospasm. So, this beta 2 sympathomimetic, it is a bronchodilator. First point, it is a bronchodilator. What is the second point? It relieves the bronchospasm. Okay. So, what is a bronchospasm? What is a bronchospasm? Sudden constriction of a bronchial smooth muscle. If there is a sudden constriction of a bronchial smooth muscle, is termed as bronchospasm. So, this beta 2 sympathomimetics, it can relieve the sudden constriction of a bronchial smooth muscle. So, what the drug, how the drug will act here? The salbutamol drugs will increases the cyclic AMP levels in the mast cell. So, what is the cyclic AMP? What is the full name of cyclic AMP? C. C stands for cyclic, okay. And what is the full name of AMP? Adenosine monophosphate. So, here the salbutamol will increases the adenosine monophosphate levels in the mast cell. By increasing of these cyclic AMP levels, what is going to happen? It will release. So, what is going to happen? It will inhibit the release of inflammatory mediators. By releasing of inflammatory mediators, finally you can see the bronchial constriction will be decreased and finally it will act as a bronchodilator. So, this is a mode of action for beta 2 sympathomimetic. So, we will see in detail here in a flow chart. So, this is a salbutamol. So, which drug it is? Salbutamol is a beta 2 sympathomimetic drug. So, what is a sympathomimetic drug? Sympathomimetic drugs are also called as adrenergic drugs, yes or no? So, sympathomimetic drugs are the adrenergic drugs. So, adrenergic drugs, see if I am talking about the adrenergic drugs, how many types of receptors are there for adrenergic drugs? Alpha receptor and beta receptor. Just forget about alpha receptor, this is not included in our part here. So, what about the beta receptor? Beta receptor is further classified into beta 1, beta 2 and beta 3. So, we know that beta 1 receptor is located on heart, beta 2 receptor is located on smooth muscle. Okay. So, this is the reason why the salbutamol is called as beta 2 sympathomimetic drug. Why it is called as a beta 2 sympathomimetic drug? Because the salbutamol will activate the beta 2 receptor. Where the beta 2 receptor is present? Beta 2 receptor is present on the bronchial muscle. After activating of this beta 2 receptor, it will activate the adenyl cyclase activity. After activating of adenyl cyclase activity, there will be increase in cyclic AMP levels. Just now I had explained you adenosine monophosphate levels. So, it will increases the adenosine monophosphate levels. Finally, the muscle will get relaxed and finally, it will causes the bronchodilation in action. So, this is the mode of action in detail of the salbutamol. Salbutamol is a beta 2 sympathomimetic drug which will activate the adenyl cyclase activity and it will increases the cyclic AMP levels. Finally, you will see the bronchial dilation by relaxing the smooth muscle. Okay. Next, we will move to the mode of action of methylxanthines. Right. So, methylxanthines, there are a lot of drugs falls under methylxanthines. If you are talking about methylxanthines, theophylline, right, caffeine, theobromine. So, a lot of the drugs, ampicillin, these are all the drugs will falls under the methylxanthines. So, before discussing the mode of action of methylxanthines, let me know one thing here, phosphodiesterase enzyme. Okay, in short you can call it as PDE, phosphodiesterase enzyme. So, what is the role of phosphodiesterase enzyme? The role of phosphodiesterase enzyme was to degrade the cyclic AMP levels. It will degrade the cyclic AMP levels. So, here what we have to do, we should not degrade the cyclic AMP levels. If the cyclic AMP levels will be get degraded, then it will causes the bronchial constriction, which we should not do here. So, the phospholipase, though here the phosphodiesterase enzyme, here the phosphodiesterase enzyme PDE will degrade the cyclic AMP levels. So, what the methylxanthine drug will do here? Methylxanthine drug will inhibit the phosphodiesterase enzyme. Why it is inhibiting the phosphodiesterase enzyme? Because this is the enzyme which is responsible to degrade the cyclic AMP levels. So, by inhibiting this enzyme, there will be increase in cyclic AMP levels. The increasing cyclic AMP levels leads to smooth muscle relaxation, and finally it will causes the bronchial dilation. Okay. And next one, methylxanthines having another action, it will inhibit the release of mediators. By inhibiting the mediator release, it will causes the bronchodilation action. So, this is the mode of action of methylxanthines. Repeating one more time, methylxanthine will works on inhibiting the phosphodiesterase enzyme. By inhibiting the phosphodiesterase enzyme, you will see increase in cyclic AMP levels, and finally the bronchodilation will be seen. And the methylxanthines is a drug which will inhibit the release of mediators which are responsible for bronchial constriction. So, now the release of mediators has been inhibited. So, finally, you can see the bronchodilation action. And apart from that, the methylxanthine having 3 cellular action. What are the 3 cellular action of any methylxanthines? First one, it will inhibit the phosphodiesterase enzyme. In previous slide I had discussed with you, it will inhibit the phosphodiesterase enzyme. And what is the second cellular action of methylxanthines? It is an adenosine receptor antagonist. Why it is an adenosine receptor antagonist? Because adenosine is an mediator which is responsible for the inflammation and bronchial constriction. So, by blocking of this receptor, it will show the bronchodilation action. And what is the third cellular action of methylxanthines? It will release the calcium from the sarcoplasmic reticulum. Especially here, note this point, it will release the calcium from the sarcoplasmic reticulum. Kahan se calcium, from where the calcium is released to the sarcoplasmic reticulum? From the sarcoplasmic reticulum, especially in skeletal muscle and cardiac muscle. Okay. So, these are the 3 cellular action where you can see with the methylxanthines. First one, it will inhibit the phosphodiesterase enzyme. Second one is adenosine receptor antagonist, and third one, it will release the calcium from the sarcoplasmic reticulum, especially from skeletal muscle and cardiac muscle. So, by this figure you can understand in a very much better way of all bronchodilators in a, one platform. So, here this is a beta agonist drugs. Okay, the beta agonist drugs, what the beta agonist drugs will do, it will facilitate the adenyl cyclase activity. By facilitating the adenyl cyclase activity, cyclic AMP levels will get increases, and finally you will see the bronchodilation. And second drug, theophylline. Which drug it is? Theophylline is an methylxanthine drug. So, this theophylline drug will inhibit the PDE enzyme, phosphodiesterase enzyme. By inhibiting the phosphodiesterase enzyme, cyclic AMP levels will get increased, and finally you can see the bronchodilation in action. And theophylline having one more action here, it will inhibit the adenosine, it is an adenosine receptor antagonist, right. So, by inhibiting of this adenosine receptor, so what is going to happen? Finally, it will leads to the bronchial dilation, it will causes the bronchial dilation. And next one is muscarinic antagonists. What are the muscarinic antagonists? Muscarinic antagonists are also called as, what are the muscarinic antagonists? Anticholinergic drugs, right. Muscarinic antagonists are also called as anticholinergic drugs. Anticholinergic drugs will causes the bronchial dilation, right. So, this is the mode of action of all bronchodilators like beta agonist drugs, theophylline and muscarinic antagonists, which you called as an anticholinergic drugs. Okay, next mode of action, leukotrienes antagonists. Leukotrienes antagonists, what are the leukotrienes antagonists? Montelukast, Jafarulcast, all these are the drugs which falls under leukotrienes antagonists. You know that leukotriene is a mediator which is responsible for the bronchial constriction. So, what is the which type of leukotrienes here? So, it what the drugs here do, what the leukotriene antagonist will do, it will competitively antagonize the cystenyl leukotrienes. What the CYS stands here? Cystenyl leukotrienes. It will competitively antagonize the cystenyl leukotriene receptor. This cystenyl leukotriene receptor is responsible for the bronchial constriction. By competitively blocking of this receptor, you can see the bronchodilation action with the leukotriene antagonist drugs. Okay, so, which type of leukotrienes are responsible for the bronchial constriction, especially leukotrienes C4, leukotrienes D4 and leukotrienes E4. Okay, all these are the types of leukotrienes which are responsible for the bronchial constriction. So, this Montelukast and Jafarulcast, the leukotriene antagonist will decreases the mucosal edema, and finally it will decreases the bronchial spasm. And next one is mode of action of mast cell stabilizers. What the mast cell stabilizers will do? Here the mast cell stabilizers will inhibit the degradation. It will inhibit the cytokinin release. What are the cytokinins? What are the inflammatory cytokinins? TNF alpha, interleukins, all these are the cytokinins, inflammatory cytokines which are responsible for the bronchial constriction. So, this mast cell stabilizer will inhibit the cytokinin release and it will depresses the neuronal reflex. So, what are the uses? What are the uses of the mast cell stabilizers? It can used as a prophylaxis of asthma, it can used in allergic rhinitis and it can used in allergic conjunctivitis. So, let me discuss about allergic rhinitis. So, what is an allergic rhinitis? It is an allergic condition caused by allergens, right. Allergic rhinitis is an allergic condition caused by allergens. So, what you can see, what is the main symptoms of allergic rhinitis? Here you can see the running nose, right. You can see the running nose. You can see the running nose and swelling around the eye. Swelling around the eye is also one of the symptom for allergic rhinitis, and you can see the sneezing, itching, all these are the symptoms for allergic rhinitis. Allergic rhinitis is also called as hay fever. Allergic rhinitis is also called as hay fever. And last one is allergic conjunctivitis. This is also caused by an allergens. It is related to the eye. To this allergic conjunctivitis, you can give the anticholinergic drugs. So, anticholinergic drugs you can give here to treat the allergic conjunctivitis. So, this is all about the asthmatic drugs. Let me have the recap what we had discussed in this lecture. Okay. So, in this lecture we had covered about what is an asthma. First we had covered the point what is an asthma, and after of that we had discussed about the symptoms of an asthma. So, what are the symptoms of an asthma? Here dyspnea, wheezing, cough, all are the symptoms for the asthmatic condition. After of that we had discussed about the mediators. So, mediators are the very important factors that are responsible for the bronchial constriction. So, what are the mediators involved here? Heparin, histamine, leukotrienes, prostaglandins, TNF alpha, interleukins. All these are the mediators which are responsible for the bronchial constriction. All these bronchial constriction will leads to the bronchial asthma. And after of that we had discussed the pathogenesis. What is the main role of pathogenesis in the asthma? We had discussed, we know that the asthma is an inflammatory condition by where lot of factors that can triggers the asthmatic condition like inflammation, right, infection, irritants, pollutions or any exposure to the cold air. All these are the factors that will triggers to the asthma, to worse the asthma. So, by this diagram you can understand that what is a normal airway, asthmatic airway and asthmatic attack airway. This is the third figure by which you can see the asthmatic attack. So, this is an asthmatic attack. This is the asthmatic airway during attack. Here the airway will get very thickened. And after that we had discussed about the types of asthma. There are two types of asthma, extrinsic asthma and intrinsic asthma. Here we had discussed about the few differences, what is an extrinsic and what is an intrinsic. So, if you see an extrinsic, here immunoglobulin levels in the serum will get increased and there will be no increase in immunoglobulin levels in the intrinsic asthma. Usually extrinsic asthma begins in childhood or earlier adulthood, but in intrinsic asthma it develops later in childhood. Okay, and in extrinsic asthma the main asthma is due to because of hypersensitivity reaction to the allergens, but which is not recognized allergens in the intrinsic asthma. If you are discussing about these two asthmas, the most common asthma was intrinsic asthma. This extrinsic asthma will cause it by an episodic, it will form like an episodes. And this is a classification. So, what are the drugs we will use here? Bronchodilators. In bronchodilators you will see the sympathomimetic drugs, methylxanthines drugs and anticholinergic drugs. This is the first category of an asthmatic drugs. And second one is Leukotriene antagonists, third one is mast cell stabilizers, fourth one is corticosteroids. In corticosteroids you can use the systemic corticosteroids and inhalation corticosteroids, and finally IgE antibodies. So, these are the 5 categories of drugs which falls under asthmatic drugs. And now we will move to the mode of action one by one. So, first I had discussed about the beta 2 sympathomimetic drugs. It will increases the cyclic AMP levels, right. Beta 2 sympathomimetic drugs will increases the cyclic AMP levels. And what is about the methylxanthines? The methylxanthines will inhibit the enzyme of PDE. By inhibiting of this enzyme, it will increases the cyclic AMP levels, and finally you can see the bronchodilation, right. And next one, they having the 3 cellular effects, okay. And next mechanism of action was leukotrienes antagonists. In leukotrienes antagonists, these leukotrienes antagonists will decreases the mucosal edema, and finally it will causes bronchospasm. Okay, it will causes decrease in bronchospasm. After giving of these leukotrienes antagonists, it will decreases the bronchial spasm, sudden constriction of a bronchial smooth muscle. Mast cell stabilizers. The mast cell stabilizers are the drugs which will inhibit the degradation. It will inhibit the cytokinin release. What are the cytokines? What are the cytokines? See, the cytokines are interleukins, TNF alpha, or the inflammatory cytokines. The mast cell stabilizers will inhibit the cytokinin release. It will depresses the neuronal reflex. Okay, so what are the uses of these mast cell stabilizers? It can use in the prophylaxis asthma. It can used in allergic rhinitis, which you can call as a hay fever, and last one is allergic conjunctivitis. Allergic conjunctivitis is an eye disorder. Thank you.